Hi, everybody, and welcome to this conference hosted by MS Focus, the Multiple Sclerosis Foundation. I'm your host, Deborah Foreman, the Educational Programs Coordinator for MS Focus, and I'm joined by Dr. Herb Karpatkin, who will be spending the next hour with us answering your questions about physical therapy and MS. So now I'm delighted to introduce him. Herb Karpatkin is a doctor of physical therapy and is board certified in neurology and geriatrics. In addition, he's also a certified MS specialist. If you would like to see his entire bio, you can look at the website. And when you checked in, I'm sure you read all of that. So let's go from there. Dr. Karpatkin, we're really pleased to have you.
Mhm.
And I'm going to give a little refresher to everybody just to make sure they know how to ask their questions. So we are going to keep all of our questions today in the Q&A area and not in the chat. So please try if all your hardest to keep them all in that. It'll make everything run much more smoothly. And if you can do the Q&A button at the bottom. Also, if you have a phone and you're listening to us on a phone, all you have to do is hit *9. And if you wanted to raise your hand to actually ask a question, we can do that. So yeah, well, let's go from there. Let's start. Let's see if we have any questions yet. I see we have a bunch of people, and maybe people aren't ready yet. Do you have anything in particular, Dr. Karpatkin, that you wanted to tell anybody before we?
No, but I'll certainly start the ball rolling and see if people can become a little less shy and ask me some questions. So, as Deborah said, I've been a physical therapist specializing in multiple sclerosis for since the 80s, actually. I'm currently a associate professor of physical therapy at Hunter College in New York City. I'm also a clinical therapist. I still see patients, even though getting on there in years, but I still make sure clinical work is part of what I do. I'm also an MS researcher, and I research specifically new types of exercise interventions for persons with MS. Um, the specific issue that I try to work on is that MS has a very, very unique pathophysiology. If you compare it, say, to stroke or spinal cord injury or traumatic brain injury, and therefore the interventions that work appropriately for, say, stroke or spinal cord injury will often not be effective in MS. So my research is based on trying to come up with very optimal and specific exercise programs for persons with MS. Part of the issue with MS is its variability. No two people are going to present the same, so I feel like I always have to invent a new therapy for every patient I see. The other thing is the intervention depends on not just how the disease presents itself in you, but also what stage of the disease you're in. For example, the physical therapy program that I might put somebody on who's relatively newly diagnosed and is still minimally disabled is obviously going to be very different from someone who's had MS for a longer period of time and has a greater disease of disability. But the bottom line is I'm I'm very confident, not just from my research, but from my clinical work, that physical therapy really can benefit anybody with MS. And part of my life's goal is to try and get everybody in the world with MS on some type of exercise/slash physical therapy program.
Thank you. Not only are those words that come out of your mouth, but we know that that's truly your mission. Like, I love that you're not just saying it, but you actually do it. So, do you have any suggestions for stretches and exercises for foot drop or drop foot?
Sure. Foot drop, for those of you who don't know, is a condition whereby when you take a step with one leg, your toe catches the ground. And it is very often a reason for falls, for loss of balance. A very common scenario I hear is that a person comes to see me with a fall and they caught their toe on some uneven pavement. The reason for a foot drop is usually having to do with tight calf muscles. And calf muscles are one of the first areas that can get tight in persons with MS. At the same time, the opposing muscle group, called the dorsiflexors, or the muscles in the front of the shin, get very weak. So every program that I'm on, that I give to a person with foot drop, is going to include some type of calf stretching and some type of ankle dorsiflexor strengthening. Plus, I train the person to really focus on remembering to walk, striking their heel every time they walk. And at this point in the talk, very often people say, can I tell them what the exercise is? And I can't tell them on a webinar, but what I can do is Deborah will share my email with the group, and whoever wants the exercises, the specific exercise protocol that I do, email me and I will send them to you.
Thank you. Elizabeth wants to know, what do you think about the Japanese fast, slow walking method?
I'm really glad you brought that up. Someone's been up on the research. That's impressive. The fast, slow walking method is actually something that I have been doing in a slightly different form for years and years. The fast, slow walking method is to intersperse periods of fast walking with periods of slow walking. It's quite a good idea for people with MS because you get the practice of walking fast, but before you fatigue as a result of developing too much of an increase in core temperature, you slow down and recover. Now, I've done a lot of research into something very similar, which is called intermittent walking, where I have the person who I'm working with intersperse periods of walking with periods of rest. The idea behind this is that you get a greater volume of walking. So if you ask somebody with MS to walk without taking a break, just walk as long as you can, they may run out of gas after 5 or 10 minutes. In intermittent walking, if I tell them walk 3 minutes, rest for 2 minutes, walk three, rest for two, these patients can walk for 20, 25, 30 minutes total, as long as they take the breaks. So the volume of walking is greater. The problem for a lot of persons with MS is they can't perform sufficient volume of exercise to get good training effect. So with intermittent walking or with fast, slow walking, you're able to get a greater volume. So I think it works. I train my patients to take breaks, to alternate fast and slow. To alternate stopping and starting, taking breaks with walking, because I think they'll get a greater distance, a greater cumulative distance that way. But the fast, slow walking seems to have an advantage that you don't stop entirely. I prefer a bigger stop because I believe the more you rest, the farther you can walk. But to be honest, either of them are going to be effective.
Hmm, great answer. Good question. So Linda has her hand up. I'm going to go ahead and let her talk. Linda, you have to allow for me to unmute you. Let's see. There you go. You have to unmute yourself.
Hello, Linda.
I don't know.
Linda, you're still muted.
Linda, you have to.
Oh, you,
All right, can you hear me
okay,
now?
I
We
can hear you
can.
now.
Okay. I've had an EMG. I have primary progressive MS. I had an EMG in the last year that showed I had a compressed perineal nerve
Uh-huh.
that that is partially that could be partially contributing to my foot drop. It does cause a lot of times I turn my ankle outward too.
Mm-hmm.
What can I do to improve that? The neurosurgeon that I've talked to is not ready yet to help me surgically with that, but I can't find ways to improve it at this point. Can you give me some suggestions?
Ooh, off the top of my head, it's hard to say without knowing where the compression is. The compression is not due to the MS. Okay, compressed nerves are not a symptom of MS, but it certainly can present as a foot drop. Damage to the perineal nerve can result in a foot drop, or more likely, an increased turned ankle. There is a PT technique to help with nerve compression called nerve gliding. And if you get in touch with me, I can get you in touch with a PT who specializes that in your area.
Hmm.
But it's a technique that is specifically developed to basically untrap trapped nerves or
That's what I
loosen.
understand because showed up on an EMG. It would be a peripheral nerve and not a
That's correct.
central nervous
Right.
issue. So,
Yeah, it's not MS. So this is not an MS problem. Um,
okay.
and the fact that the surgeon doesn't want to operate indicates it's probably not that severe, which means you want to try and get treatment for it before it's severe. So contact me, make sure you let me know what your location is, and I'll try to find somebody who is trained in nerve gliding techniques who you can contact.
Okay. I am in Michigan, but yeah, I'll contact you.
Okay, well, Michigan's a pretty big state.
Yes.
So give me like a zip code or something and I'll take it from there.
Thank you.
And Linda, by the way, Bhavya just put Dr. Karpatkin's email address in the chat area, so you can grab
Oh,
it
okay.
from there. Everybody, in fact, can grab it from there.
Thank
Okay,
you.
thanks, Linda. Bye-bye. Okay, so now how do we find PTs who specialize in MS? This is a great question, Suzanne, because I know that Dr. Kropotkin has a list. Not easy to do in remote areas. She says that she lives in Cape Cod. So,
Cape Cod shouldn't be that hard. Send me, I'm not going to access my list right now because it takes a lot of cross-referencing to do it. Send me your contact information and I will find the best person I can who's nearby you.
thank you. Elizabeth wants to know if you have any thoughts on red light therapy.
Um, I know of no evidence that shows that it is effective in treating any of the aspects of MS. Some patients I have told me of reports where it's helped. I try to be guided by science and by scientific evidence. If the evidence is not there, I don't recommend it. It's not harmful. So there's that, but you know, I've been in the field of MS for a long time, and every few years some new intervention pops up which touts itself as, the thing for MS. And it lasts about a year or two and then it dies out. So red light is in all the vogue nowadays. I see it on internet ads all the time. I am not aware of any evidence that supports it. That does not mean that it doesn't work, but I can't recommend it without evidence. I really try to be guided by science on all things. Uh, um, my biggest concern is, like so many of the other things I've encountered over the years, people say, well, this will, you know, just send us the money and we'll send it to you and this will lead to improvements in your MS. And what can I say? Buyer beware, caveat emptor.
Smart advice. And we have somebody who says that she's a 62-year-old female with relapse remitting MS. She was diagnosed in December of 22. She had a hydrodilation procedure 6 weeks ago, and she's having trouble getting to PT regularly due to her demanding work schedule. She also has home exercises, but wants suggestions for additional techniques that might help her gain some more movement in her right shoulder.
Oof. Again, with that information, it's hard to tell. Your work schedule, I definitely respect that, if you're trying to live a full life and trying to find a PT who can accommodate to your schedule, that can be challenging. A lot of PTs do tele-rehab, meaning they can work with you online. And that, for many of the people who I see who I can't work with in person, I end up doing a tele-rehab session. I see patients on tele-rehab all throughout the United States and Europe. So
Hmm.
tele-rehab is I would love to be able to fly to Europe to see a patient, but PT doesn't make that much. So tele-rehab has actually been it's one of the few good things that came out of COVID, that I started seeing a lot more people as a result of tele-rehab. So again, if you're interested in pursuing this, I could give you some options for tele-rehab easily enough.
Thank you. John from Facebook is asking, can you get MS from head trauma, or can it be dormant in your body until you hit your head, when trauma occurs?
That's actually a good question. So the current knowledge right now is MS is a response to some type of environmental trigger in persons with some type of genetic predisposition. Now, what that environmental trigger is or the genetic predisposition is not clear. What I do know is some persons, when they do encounter a trauma, develop symptoms afterwards. Sometimes it's a physical trauma, sometimes it's an emotional trauma. Sometimes the symptoms can be very, what are referred to as subclinical, nobody notices them. And then a person can develop some other illness, which um, which limits the reserves that kept the MS in check before. So the head trauma will not cause the MS, but it's possible it could be a trigger.
Thank you. Are there research papers that you can share regarding new exercises that are beneficial?
Oh boy, can I. I mean, you're basically talking about my research. So um, email me and I'll send you more papers than you'll possibly know what to do with.
Okay. By the way, again, for those that didn't hear me before and are new on this call right now, we put Dr. Karpatkin's email address into the chat area. So go ahead and take that off of there, and you can email him at your leisure. So Karen says she went to a rehab PT, and they worked her really hard. She couldn't even walk to get into her house. Doesn't seem like this is right. What are your thoughts?
My thoughts are trust your instincts. It's not right. Um, a rehab. So again, this gets to some of the things I was saying earlier on today. The rehab that might be effective for, say, a stroke patient or a spinal cord injury patient or a Parkinson's patient or a brain injury patient will not work for persons with MS, period. Okay. The story that you've heard, it breaks my heart and it infuriates me because it means the PT didn't really know what they were doing. And doesn't mean they were malicious, it means they were uneducated. When I work my MS patients super hard, I also give them lots of recovery. Okay. And that's the key. If you're too tired to do anything the next day, you've worked too hard. It's not dangerous, it's not going to cause an exacerbation, but it's going to be of more limited effectiveness than a program which you'd be able to tolerate. So if you're going to go back to that rehab PT for another session, tell them that and urge them to get in touch with me. I mean, I think any PT who works with MS has probably heard of me, and I work with therapists, throughout the United States and Europe to give them ideas on how to work with their MS patients. So the techniques that I use are not hard to learn, but if you don't know them, you don't use them. So you are correct. That should not have happened. It indicates that the person probably did not have as much training in MS as they should have. But this is a fixable problem. Either find an MS therapist who does, or if you want to go back to that person, have them reach out to me.
Yeah, thank you. And this, although it sounds somewhat the same, it's really not. Can you overdo PT? What point is too much? Today I had PT and now extremely spastic. I feel session was good as it stretched me in ways I can't move anymore. So, you know,
Again, kind of similar. The
mhm.
stretching is great. It sounds like they probably stretched you too hard. With stretching for persons with spasticity, a lot of therapists make the error of stretching really, really hard. And that's not what you need. You need to be stretched really, really long. So rather than stretching to the end of range as far as you can and holding it for 20 or 30 seconds, I'm more likely to have somebody stretch to a comfortable level, but hold it for several minutes. That's going to be, firstly, more likely to increase your flexibility, and second, it's going to quiet down your spasticity.
Thank you. Colleen says that she wears a brace on each leg. She'd like to do exercises without braces and then with braces. Please explain how exercise are done differently with or without braces. Plan on getting set up with a PT in my area, Greater Minnesota. Thank you for helping me get connected.
Sure. So a brace is kind of a double-edged sword. The advantage that a brace gives you is it locks your foot up. So if your foot doesn't have any range of motion, your foot is held in the right position. It's locked in the correct position. If your foot is too weak to move, the brace holds that foot, so it takes away any need for muscular movement. So what I have patients do who wear braces is I make sure they do most of their walking in the braces, build up their walking tolerance, build up their aerobic fitness. The limitation of braces is the same as the strength. Okay, you wear braces because your feet have lost their flexibility, but once you wear braces, you're going to lose more flexibility. So I have my patients, when they need to stretch, take the braces off and stretch and strengthen with the braces off. So the walking, they definitely do with the braces on. The stretching and strengthening, they do with the braces off. For balance exercises, I have them go both ways. You need to learn to do balance with braces on and braces off.
Thank you. And Mary's curious to know if you have any experience with Feldent Feldendrich
Feldenkrais?
lesions.
Feldenkrais. What?
Any benefit for MS patients?
With Feldenkrais?
Mhm. Thank you. You said it
Um,
much better than me.
uh, I think Feldenkrais is great. Um, uh, I'm, I'm not certified in it, but I've taken a lot of training in it. And basically what Feldenkrais is a type of movement therapy invented by, I believe, an Israeli engineer named Moshe Feldenkrais. And he came up with this idea of learning to move um, by being really aware of the individual movements. And I use very, very similar techniques. The idea behind Feldenkrais, and I remember this really well from the classes I took in it, is to be aware of every aspect of a movement. So when you're doing a sit to stand, you pay attention to what's happening at your ankles and your knees and your hips and your shoulders. And you really focus in on that. And that's something that's an aspect that I use in my therapy a lot. The one caveat for that is the same as everything else. If the Feldenkrais practitioner does not have experience in MS, that can be problematic. So, um, if you want to work with a Feldenkrais practitioner, I think that would probably be a net gain, but make sure they have some knowledge of MS.
Thank you. We have a couple people asking for information on the psionic.
Yes, the psionic. Psionic is what's referred to as a neuroprosthesis. It's a sleeve that's worn over the arms and the legs that gives electrical stimulation to specific muscles. Um, um, uh, a lot of my patients have gotten them, spent a lot of money on them. I have not seen them to be that effective. Um,
Hmm.
I've worked with some people, I've worked with some psionic reps to help optimize, but the psionic is really too simplistic an approach to gait. The idea being is that it will trigger or activate muscles that have gotten weaker at the right time for gait. The thing is, it's activating muscles is not an on-off switch. It's a graded switch that changes in response to the physical task that you're doing. The other problem with it is it'll take care of the weakness, but if you've lost range of motion, if your muscles are stiff, then the psionic is not going to be that useful because the muscle will try to contract
Hmm.
with the stimulation of the psionic, but it will not fully contract because of the range of motion limitation. So there's a patient, I'm actually going to be seeing him on Wednesday, who a couple of years ago spent a lot of money on psionics, and he was not, and the rep kept assuring him that it would make all the difference, and all I can say now is he does not use them anymore.
Thank you.
It's not that I'm not trying to ruin anybody's business, but you know, I'm not in the business of, helping equipment manufacturers. I'm in the business of helping people with MS. If psionic worked or red light therapy worked, great, amazing, fantastic. I would be shouting it from the rooftops. But if it don't work, I'm not going to recommend it. Feldenkrais, there's actually some pretty solid evidence in some top journals that Feldenkrais is not only effective in multiple uh, neurologic conditions, but there's also specific evidence in MS. So I'm that's why I'm feeling more confident about it. The science is there.
Thank you. And before this has nothing to do with these questions, but because you have such a passion for MS, I've never asked you, did you go into MS because you know someone that has MS that you
No,
loved and you just felt like it was something you wanted to do? No?
no. Here's the story. I graduated from PT school in the 80s and I worked first in traumatic brain injury. I did that for about 5 years and I was very, very, it was an incredible and wonderful and intense experience. And then a few years after that, I had a chance to um, be a supervisor in a new unit that was opening up that combined traumatic brain injury, which I knew a lot about, and multiple sclerosis, which I didn't know anything about. And
Mm.
so I joined that unit. And fortunately, the person who ran the unit was a very, very famous MS doctor named Joseph Herbert, who became a mentor to me. And I told him I was not that enthused at the time about working with persons with MS because um, my impression is usually that they just get worse. And he challenged me on that. And
Mm,
he said, look, all I want you to do is see my MS patients for a few months and tell me if you still think that way. And he very happily proved me wrong that I found these MS patients definitely benefited from physical therapy. So I started talking to the other therapists in the hospital I was working. He said, you got to work with these MS patients. And they were like, nothing doing. I don't work with MS patients. They're, terrible, miserable, nasty, mean people. I'm like, no, they're not. They're persons with a neurologic condition, and you're trained to work with that. And so I just got very motivated to say that this is, we're PTs, we're supposed to help people move. There's this whole population out there that is not getting the benefit of therapy, and I couldn't stand for that. So, and so since then, I've just been on the warpath.
and making a difference. So thank
Well,
you. Thank you for
so,
that. So Desiree said that she's, finding new providers is stressful enough.
yes, it
How
is.
can we best search and find medical providers, physical therapists included, that have
Contact me.
adequate knowledge of MS?
Contact me.
Okay, there you go. Desiree, look in the chat. His email's there. Okay, let's see here. My left hip flexors are non-functional, meaning I get no lift, i.e. unable to march, lift leg while seated. If I walk without my hip flexor, my leg drags. Any
Yeah.
suggestions for this situation?
Well, the first that's not an uncommon thing. I see it quite a bit. Um, the There's two possible reasons, though there's multiple possible reasons. The two most likely ones are hip flexor weakness or hip flexor tightness. And there's a very specific exercise for that. I'm going to describe it to you, but what you should do is email me and I'll send you the specifics of it. Um, I don't recall if you said it was your right or your left hip flexor, but let's just say it was your right. Uh,
Um, yeah, I don't think he said,
okay,
or, and they
let's
didn't
just
say left or right.
assume it's your right. So you lie on your bed with your right leg hanging over the side. So sort of dropping off the side, and your left knee bent. And you should feel a stretch in the front of the thigh that's dropped over the side. And then when you feel that stretch, try to lift that leg up in the air a few inches and slowly lower it down. That both stretches and strengthens that muscle. If you send me your email and remind me of this situation, I will give you a detailed description of that exercise.
Thank
It,
you.
it's not an uncommon, I hear that fairly commonly, hip flexor weakness.
Yeah. Larry wants to know if aqua therapy is good for MS.
Um, Depends on who you ask. Um, I have a lot of patients who absolutely love aquatherapy. Um, Here's my feelings about it. In terms of making you move more, um, because of the weightlessness of water and the cooling of the water, it's excellent. And persons with MS generally don't move enough. And uh, so aquatherapy makes them move more and they get fitter as a result of that. So that's the positive. The limitation of aquatherapy is that uh, the it doesn't really carry over into land. So if you have trouble walking or balancing on dry land, practicing in the water is not really going to improve it that much. It's going to improve your overall fitness, and that's great because persons with MS generally do not have sufficient fitness. And if I have to choose between somebody with MS not moving at all and getting into a pool and moving, I'm going to choose the pool every time. But I
Mhm.
think the benefit of a pool is somewhat limited because there's no functional carryover to the movements that you really want to do, walking or balance or things such as that.
Thank you. Karen would like to know, how do you determine the correct dosage of baclofen, or do you feel Flexerol is better? Her knees get so stiff and she must have her husband help bend them just to get into the car.
So I'm a physical therapist, not a physician, but if the baclofen, if your knees are so stiff they won't bend, um, it sounds like you may be underdosed. You have to speak to your physician about that. I will, however, give you and your husband a quick tip to help bend your knees. So if your knees are uh, too stiff to get into the car, um, one quick trick he can do, or you can do, to bend your knees quickly is put some really hard pressure into the area behind your knee. It's called the popliteal fossa. And when you do that, it stimulates the muscles that bend the knee, and the knee tends to relax very quickly. So in the area behind the knee, okay, the area that creases when you bend, okay, put really firm, hard pressure, and that tends to bend the knee very quickly. But if your knees aren't bending, it sounds like you're underdosed on baclofen and you need to speak to your doctor about it. And if the doctor maybe doesn't understand spasticity, you have to find someone who does. The problem may be, though, is a lot of times when you get enough baclofen to control the spasticity, it can be a little bit sedating. And people found that to be a problem. So this is really a conversation for you to have with your physician. But in the meanwhile, use that quick relaxation technique I just told you about.
Good. What are your thoughts on adaptive shoes like Cadence?
I don't know what cadence is. I don't know what an adaptive, I don't know what you mean by
Okay.
adaptive foods.
Okay. Makika, I don't know, I can't pronounce the name that wrote it, but if you have a suggestion um, to explain it better to him, then go ahead and type that in. Any thoughts on neuroacupuncture? A tau patch?
Yeah, I've done some research into acupuncture, um, and it was a bit of a mixed finding. Um, Me and my colleagues published a paper a couple years ago on acupuncture and MS, and we got top acupuncturists to treat people with MS, and we looked at everything. We looked at strength, flexibility, sensation, walking, balance, and um, nobody really showed any improvements in that. On the flip side, though, all of them said they felt better with the acupuncture. So it could be that what the acupuncture affected is something that I did not know how to measure, but I did not see improvements in physical function. So I'm not saying don't get acupuncture. I have a lot of patients who get it and they swear by it. But what I'm saying is there are really no studies that I'm familiar with that can point to acupuncture being a something that resulted in improved mobility with MS.
Thank you. So I'm going to ask everyone once again, just as a reminder, to please keep your questions out of the chat area and only in the Q&A area. I'm finding people are double dosing the same question in each, and it's quite confusing. So if you could do that for me, that would be great. What do you know about the Bioness STEM devices?
Sure, the Bioness is sort of like the Psionic. It's a neuroprosthesis. It's a kind of an ankle brace, which when you're about to take a step, it stimulates the um, a nerve which makes the front of the foot come up. Um, it's similar to the psionic in many ways. I think there's a very narrow window of usage for it in MS. In other conditions, maybe not quite as narrow. I've seen too many people get Bionesses or similar devices thinking that it would, help their walking tremendously, and it did very, very little, partially because they don't have the flexibility in the first place, and the Bioness ends up being a very expensive dust magnet in their closet. So if you're going to get it, it's expensive. Make sure it really is helping you. You have to feel like it's helping you, not the sales rep.
Thank you. Desiree says that she's been wanting to restart some sort of exercise regimen. The pandemic put a kink in hers. She struggles with heat intolerance more frequently lately. She has a cooling vest to use. Would working with a PT be a better way to get started? Could that be a potential substitute
Substitute for what?
for, I guess, a regimen of exercise?
I think a PT should not only work with you, but give you a regimen to try at home. Every single one of my patients, without exception, I see them as often as I see them, but I also give them exercises to do every single day at home. Okay. I tell my patients to think of exercise like medication. You take your meds, you do your exercise. Okay. And you don't take your meds only when you see your doctor, you take your meds every day. I try to think of exercise like medicine. You get the right exercise at the right dose with the right timing to achieve a specific result. So I don't think it has to be either see a PT or do exercises. I think it must be both. You see a PT and you do exercises, and the exercise program should come from the PT.
Thank you. Brian's asking, can you speak a little on the relationship between parasites and MS?
When you say parasites, are you referring to insurance companies? Right. Sorry. I didn't do that. Yes, I did. Um, you're talking more about like the role of I would have to find out more what you mean by that. That sounds more like a neuroimmunology question. Um, um, I do know, I'm just going to talk generally about it because I'm not quite sure what you mean. Infections will always make your MS symptoms worse. Um, so if you have any type of either viral or bacterial infection, your symptoms will get worse. It won't make the disease course worse, but while you have the infection, your MS symptoms will be worse. And this will, uh, uh, and so this is why a lot of times when I or one of the physicians I work with see a patient who says they feel like they're having an exacerbation, the first thing they'll say is, well, let's check you for an infection first, a UTI or respiratory infection or something like that. And very often that is exactly what's happening. And once they're treated for the infection, they get better. So I'm not sure if that answers your question, Brian, but parasites, assuming you were not talking about insurance companies, which trust me, I can talk about all day. But if that is what you're talking about, that would be my answer.
Thank you. Maria is asking, how do I walk? How do I work on stamina, especially walking?
A great question. The best way to work on stamina in walking is to the increase amount of walking that you do. Now, the first thing you're probably thinking of, I have MS. I can't do that much walking. And that's correct. So there's a technique which I've been doing research on for years called intermittent walking, where I tell persons to walk for relatively short distances, maybe 30 to 60 seconds sometimes, then sit down and recover. 30 to 60 seconds, sit down and recover. And a very familiar scenario that I'll have with a new patient is I'll tell them, I'll say, how far can you walk, continuously without taking a break? And maybe they can walk for 3 or 4 minutes before they need to take a break. Then I'll say, okay, now walk 30 seconds on, 30 seconds off. How far can you walk then? And they'll end up walking 10 or 15 minutes because they've taken the break. What happens in a lot of cases with MS fatigue is that as you walk, your core temperature heats up. As your core temperature heats up, there is decreased conduction through demyelinated nerves. So if you take breaks, it allows your core time to cool off so you can walk longer distances. So the best way to build endurance is to not do the same task continuously, but do it intermittently.
Thank you. The person that asked about the cadence shoe, she says that it is an adaptive shoe for foot drop.
I'm going to do a quick search on it right now so I can figure out what you're talking about. I have not heard of it before.
Cadence.
Give me 1 second.
I can always email you also. And
Oh, I'm curious now. Cadence shoe.
Oh, you know what, Jane? Thanks for telling us that, because she said that acupuncture helps her depression. So
I believe that, but
yeah, yeah.
so what the Cadence shoe has is I'm looking at pictures of them now. They have very elevated toes. Um, and they also, so your toes don't drag, they're lifted up. Um, I've never worked with it. It seems like a reasonable idea, but as a PT, I'm going to tell you, you need to be stretching your calf muscles and you need to be strengthening your anterior tibial muscles. I could see how the cadence shoe could be of some help in some people, but I've never specifically worked with it. I have no experience.
Okay. And Karen would like to know, what are your thoughts on New Step and benefit for MS?
Excuse me. New Step is a type of uh, uh, continuous seated exercise device. Um, uh, it allows you to exercise at a wide range of limitations. It's sort of like a cross between a seated bike and a stepping machine. Um, a lot of my patients with MS love them because they're very MS friendly. They allow you to build up leg strength. They build up some aerobic conditioning. The problem is it will not really carry over into walking. Okay. Again, the only way to really improve in walking is to practice walking. So if you practice a lot on a new step, it will improve your cardiovascular fitness, it will improve your leg strength, and it'll improve your ability to use a new step. But it will not necessarily carry over to walking. I'm not
Hmm.
saying don't do it. I'm saying just be clear on what your expectations are.
Interesting, because Samia just wrote that the Cadence shoes have a sliding plate on the front so your toes don't catch. It also has a tapping noise to reinforce a walking pattern.
Again, I'm not familiar with it.
Yeah.
A sliding plate sounds a little bit scary to me. Um,
Hmm.
considering all the patients I know who have slid on slippery floors. So makes me a wee bit nervous, but again, this is the first I'm hearing of it all. I'm just
Yeah.
certainly follow up and see if it's something I can recommend to my patients.
I don't know if this person meant acupuncture, which we discussed, or if I'm not familiar with the phrase acupressure.
Acupressure is rather than using needles, you use fingertip touch at
Hmm.
varying degrees of pressure. Um, again, the the science, the small amount of science that's done does not support its use to improve mobility. That being said, I know a lot of patients who said it really is helpful for mood and depression, sense of well-being. And I think that's great. But in terms of addressing physical therapy issues, I I don't have any information that would lead me to recommend it.
Thank you. And Caroline is asking, is wearing a weighted vest okay to use when you're
Oh,
walking with MS?
great question. There's some really new, interesting research. And as a matter of fact, there's one patient I'm seeing now who is using it. And it's good to wear for practice, but not for walking. So what I'll do with this and with other patients is when I see her, or even when I don't, I tell her to practice walking with the vest on, in her hallway or driveway or whatever. But then when she really needs to walk, take it off. The idea is by wearing the vest, you have to generate more force to walk. So it makes your walking that much stronger. When you take the vest off, the training of that tends to last. So it's a relatively new thing. I think it's a good idea. It's been shown to be effective in stroke. And so I could see myself doing a research study on it soon. I think it's a very credible idea, but wearing it for training, not for regular walking.
Thank you. How about Empira? Is it good for walking? It's a pill.
Um, Again, this is a medication, and I'm not a physician, I'm a PT. My own experience is Ampera can be a very effective medication. It's referred to as the walking drug. Um, the the it's supposed to improve conduction through demyelinated nerves. I've known many patients who benefited from it. It's not a panacea, but it does lead to improvements. Full disclosure, years ago, I used to do some work for the company that made it called Accorda. So I just want to disclose that. I don't anymore. But that being said, this is a discussion for you and your physician. As a physical therapist, I try to, if a patient has not tried Ampera, I recommend that they discuss it with their physician.
Thank you. Do you have any thoughts on Orange Fitness, yoga, Pilates? They don't want to overwork themselves.
Yoga is good because it tends to be slow, long, gentle stretches, which is very good for maintaining flexibility. It's not going to do as much help for regaining walking. Some of the poses certainly improve balance. Um, uh, the real question is what are we talking about when we say yoga? There's so many different types. Um, so I can say certainly without fear of contradiction that hot yoga, which is a type of yoga, is really bad for people with MS for obvious reasons. But as one of my colleagues once said, saying that I do yoga is like saying that I take medicine. Don't know what kind of medicine, you don't know what kind of yoga. So generally it tends to be a net gain, assuming it's not a yoga that is either hot yoga or makes you overexercise. Pilates, I know a lot of my patients love it. There have been one or two articles which have suggested that it could be useful. I think for very high level patients, it could probably be very useful, but Pilates was something that was developed for dancers. Dancers are persons who are at the peak of the 1% of mobility. This does not describe persons with MS.
Hmm.
That being said, movement is always going to be better than not moving. And if Pilates, gets you to move more, great. But I have not, in the patients of mine who do Pilates, I have not seen anything that makes me feel it's anything special or unique. I'm not saying it's dangerous or not useful, but the issue that I have is Pilates was developed for the best of the best of the best when it comes to mobility. And sadly, persons with MS do not fall into that category.
Thank you. Colleen wants to know, do you ever use the copper knee sleeves during exercise for stability?
Copper knee sleeves.
Mm-hmm.
Not familiar with them. If the copper is something that's supposed to help with, I don't know if it's copper or something else, but it's supposed to, help with fatigue or something like that, or the evidence for that is zero for MS. Um, a
A
knee
good answer.
a knee sleeve a knee sleeve in and of itself can improve some some knee stability. As a matter of fact, I'm seeing a patient on Wednesday who rather relies on them. And she prefers wearing those to braces, and I think it's fine. To me, they look kind of uncomfortable and very hot, but it works for her. The copper, I don't know what that's about. I try to stay up on every single new intervention that's discussed that comes up because I want to be able to give my patients knowledgeable feedback on it. And I always will say, is there science? Is there cause and effect? Okay. If there isn't, I can't recommend it.
Thank you. Sherry wants to know, how do I prevent the PT from aggravating my sciatic nerve?
If the PT is aggravating your sciatic nerve, I'm kind of worried about that PT. A PT should be making the sciatica better, not worse. Um, I'm hoping you've told the PT that the therapy is worsening the sciatic nerve. Um, Being able to avoid sciatic nerve pain should be pretty simple stuff for a PT. So make sure that you're telling the PT that the therapy is worsening the sciatica. That should definitely not happen.
Thank you. This is actually very interesting. The VA had this person going to PT with an excellent doctor, but they limit the number of sessions per year. It seems they don't believe that this person's body's experience of MS can improve with or without PT. Do you have any suggestions of how I can might be able to change the bureaucracy's opinion?
So this goes back to the parasite question, doesn't it?
Yes, it does.
How to change bureaucracy's opinion? I'm trying to think of a civilized answer here. Um, if they don't think that PT is effective, then they are simply unaware of the science. And I don't know. We're sadly going through this sort of anti-science period in the United States nowadays. So I'm wondering if that has something to do with it. But the science is very, very clear. And there's thousands, if not tens of thousands of research articles that give solid class A evidence that exercise and therapy is an effective treatment for MS, both in terms of treating the symptoms and disease modification. So you can put them in touch with me and I'll go right out there and give a presentation. I'll talk till I'm blue in the face or till they are, either one or the other, but the science disagrees with them, and the top MS doctors in the world agree with this. So
Yeah, hopefully, hopefully one day. Caroline would like to know, does walking help with neuroplasticity?
Walking helps with neuroplasticity. Neuroplasticity refers to the ability of the brain or the spinal cord for that matter to change as a result of practicing a specific task. So neuroplasticity is very specific. If you practice a lot of walking, your walking will get better because of neuroplasticity. But remember earlier today we talked about aquatic therapy or using a new step. Aquatic therapy, if you practice a lot of it, you'll get better at doing exercises in the pool. But because you're not practicing what I would call the criterion task, which is walking on dry land, you're going to have very, very limited, if any, neuroplastic improvement from that. So the short answer is yes, walking will improve neuroplasticity, and the more walking you do, the more of a neuroplastic effect you're going to get, which is why I have all my patients do intermittent walking. Do as much as you can. It's dose specific, and the dose needs to be large.
Thank you. And our last question here is, when your core temperature goes up from moving, does your blood pressure go up?
Not necessarily. It may slightly, but it may be that it's not the raise in core temperature that's raising your blood pressure, but the exercise itself raises your blood pressure to meet the increased cardiac demand.
Nice. Okay. Thank you. So that does bring us to the end of our time. Thank you, everybody.
Can I just say one thing, Deborah?
Sure, absolutely.
I've been giving thanks as always to my heroes at the MSF for putting this stuff together. I think you guys are so great, but I also want to say I've been giving these talks for a long time now. These were some of the best questions I've ever gotten. So
Nice.
what an educated group I have today. I sometimes I feel like I'm answering the same questions over and over. And this is such a educated, well-prepared group. I feel like, my students, you showed up prepared for class. Wow. Kudos to you guys.
I
So
know.
again, if you have specific questions, reach out to me. This is what I do. I'm the MSPT guy, so just reach right out to me. And sometimes it takes me a few days because my dance card is pretty full, but I will answer your questions. So please do so. So thank you again.
Thank you. Okay, and that does bring us to the end of our time. If you've missed any part of this conference, it has been recorded as usual, and it will be available through the MS Focus Facebook and YouTube channels. Please reply to your registration email for information on how to access the recordings, or just to sign up for our newsletter, which is going to tell you all about the upcoming events. Also, you'll be receiving a short survey when you leave the conference. Please take the opportunity. It takes only a second to fill it out, but it really does help us determine what your needs are, what you're looking for, what topics you're most that are most meaningful to you. So we'd appreciate you taking that minute. Our next teleconference is going to be Thursday, August 21st, this Thursday. It's at 4:30 p.m. Eastern. Mariana Klott, PhD, will be presenting the topic of combating isolation with mindfulness. It should be really, really good if you have the opportunity to come. Our sincere thanks to all of our attendees for your participation, and especially Dr. Karpatkin. As always, we really appreciate you doing this. And you are like the Energizer Bunny. One after another, you don't even come up for air. So we really appreciate it. Thanks, everybody. And I hope everybody has a great night. See you again, Dr. Karpatkin. Thank you.